Dr. Staci Avakian. We're here today at Back Pain Relief Center in Vineland in New Jersey. We're here with one of our patients. She's got some discomforts and pain that happened in her upper middle back, her neck, and over her right shoulder and arm. So she's been coming and feeling a little bit better and gradually improving. So we're going to do one of her adjustments today. I like to start with the low back first, but we're going to go ahead and do a little bit of massager to help relax some of the tissues. That's okay, right? You know to always tell me if anything doesn't feel good, right?
Yeah.
So this is just a low back adjustment, which helps just absorb some of the pressure so it's a little bit more comfortable for the patient. Good. And so now we're just doing a little manual manipulation to the thoracic spine or upper back. You may have heard some of the cracking. Is that okay, that pressure?
Mm-hmm.
Just a little bit of soft tissue work in the upper neck and shoulder area. And then this helps to stimulate proper positioning of the muscles, movement in the joints. Is that pressure okay?
Mm-hmm.
And to actually vibrate the bones back to their alignment. And so that's our adjustment for today. Dr. Staci Avakian, Vineland Back Pain Relief Center.